Hi everyone, I'm here again to analyze data as a data analyst in turn. And one of the amazing things of being a data analyst is the ability to draw insights into numerous data. My name is David Francis, and I've been privileged to work with a team of amazing data analysts through quantum analytics, and it's been an incredible journey. So this is one of the projects, COVID-19 data report from Nigeria, and I'm going to take you through how I was able to achieve that. First and foremost, of course, one of the insights I'm going to share with this data is how really the data have not been comprehensive enough. So I was able to compare this data with the one of the World Health Organization, and I see that we still have a lot more to do in terms of um, reporting in data reportage, number of cases, number of deaths, number of from the analysis. It's really unbelievable. Really, it's really unbelievable. For I to generate this insight, I was able to not just get the CSV file where I had and numbers of states and cases and reports. I wanted to compare the total number of population amongst the people with the number of cases that those populations have. Okay, so I is the spatial map that I was able to generate on Tableau. For instance, we have Sokoto. The population in Sokoto is 5.123 173 million in persons. However, the number of cases of people on admission in that state is barely 8,384, and it really says a lot about analysis. It really says a lot about our reportage of cases of COVID. We are not praying that everyone should have COVID, but we praying that we should have better facilities and better reportage of what's going on really. So this is what I was able to discover in that data that was sent to me. I was also able to see here the top 10 states by number of patients discharged, and the highest population compared number of in states. For instance, in Kano, we have 13 million people in that state, and we have the highest number of persons who have been discharged so far. It's 4,277 persons. We don't have the exact number of persons who were brought in, but we have people who are discharged. So, and then the lowest of the top 10 is Akwa Ibom of a population of 3 million and barely 4,000 persons who were discharged. Then we have out, which is the population of Lagos State. The number of persons discharged was a whopping 76,000. Okay, so this is how the number of cases and deaths by states have been visualized. Lagos State seemed to have the highest number of cases lab confirmed and the highest number of deaths. That's why you could see how that visualization that took place, followed by those states. You could see how big number of deaths is 280, and followed by Kano, followed by okay, Kano is 122, Oyo State is 191, okay, followed by Oyo State, followed by Kano, Rivers, and so on and so forth. So these are the insights I was able to generate using this software. It's been an amazing time to look at the data. If and I'm so grateful for my team members, quantum analytics, and how we're able to get um, this data. And I was able to get the data from my team members. We worked on them together, and I drew up my visualization. So this top 10 by states, of course, these are all the parameters data analysis that you can think of, and this is the states by population. And of course, I had to use a map to represent that, and we have a number of cases here by deaths and by states. In each of the states, this is much more clearer. And Imo State, number of deaths 14. We have here in Adamawa, number of deaths 32, and then number of lab cases confirmed just 1,000. So we are praying and hoping that our the situation of COVID reportage in the country would improve, and of course people will um, get discharged, get healed, and of course healing should be brought to our world. Thank you so much for listening. It's been an amazing time analyzing this data, and I hope to have your comments. I hope to have your insights. I hope to have your feedback. Thank you.